Israel's biotech industry is represented by over 1,000 companies, many of them focusing on innovative medical devices. Itamar Medical in Caesarea has developed two very different devices that both use the measurement of peripheral arterial tone, or PAT.
Peripheral arterial tone is actually the monitoring of those pulses that are in your fingertip or at the extremities. They turn out to be a very important indicator, almost a non-invasive window into the body.
WatchPat is worn like a watch around your wrist. It measures PAT and other indicators that can diagnose sleep apnea, a serious condition that's associated with loud snoring.
Inside that watch is the PAT, but it's also an oxygen sensor to measure the oxygen level. We're also monitoring the body position. With an actigraph, we're also monitoring the snoring with a small microphone that's picking up those sounds as well.
Before Itamar developed WatchPat, uncomfortable sleep labs were often the only alternative to diagnosis.
I have no wires, and I do it in the comfort of my own bed. I don't have to do it in a strange lab or in a cold bed in front of a camera and other people watching me.
Medical practice always acknowledges that the simpler and more convenient the test, the more people will take advantage of it.
Patients readily take to sleeping at home. It's a very easy decision. You don't have to make a momentous decision. Do I want to sleep in a sleep lab or not? And now many, many more people are being treated where they never would have even thought of being treated.
And the device also makes life easier for the doctor.
When the device is returned, he'll plug in his PC right into here, download the data, and the software instantly analyzes and produces that report.
A printout of the device's results enables a doctor to get a picture of seemingly almost everything that happened that night.
The physician looks at it and says, well, it looks like you were snoring, for example, more when you were on your right side. When you went to sleeping on your left side, the snoring went down.
WatchPat is in wide use in the U.S. and Israel.
Take, for example, Kaiser Permanente in Northern California. They're using this device instead of sleep labs. So last year they did 22,000 tests.
Using the same fingertip PAT monitoring, Itamar Medical's EndoPat device administers a 15-minute clinic test proven to predict development of heart disease.
By stressing the artery, almost like a step function where we stop all the blood flow and then open it up with a big rush, and monitoring that result in the fingertips, we're able to mathematically determine whether or not this person is now prone to developing arterial heart disease.
Simply put, EndoPat measures the expansion of the arteries in your finger when blood flow is suddenly increased.
Well, it turns out that many individuals, especially those who are prone to start developing some form of arteriosclerosis, which is a hardening of the arteries, that they're not able to adapt to that rush of blood.
According to Rubin, if EndoPat indicates your arteries are losing flexibility, the decline can be treated before it causes a major problem.
You have the ability to actually improve. That's why I say the process is reversible. You can improve your arterial health.
In addition, EndoPat can be used to monitor progress in a patient's rehabilitation after a heart attack.
It also acts as a very nice positive feedback and positive reinforcement for the patients. When they see that their score is improving, then they're further motivated to actually keep going with the program.
Prevention Magazine selected EndoPat as one of the top 9 medical breakthroughs of 2009 for its promise to revolutionize how doctors prevent, diagnose, and treat cardiovascular disease. Find out about other exciting stories at Israel21c.org.